Assalamu alaikum everyone. Welcome to DentoScope Studio, the official YouTube channel of DentoScope Institute of Advanced Dentistry. I am Dr. Rashid Hassan, the founder and CEO of DentoScope, and we have started a live session series by DentoScope mentors. And today we are honored to be joined by none other than Professor Dr. Arshad Malik, a very well-known name in dentistry of Pakistan, and he has spoken on many national and international forums. He is the dean of HBS Dental College, and he is vice president and regent of International College of Dentists, section 15. So, welcome, sir, to Dentoscope Studio.
Thank you very much.
Today, sir, we will have a discussion about the lasers of the use of lasers in dentistry and what are the basics of lasers in relation to dental surgeons. So,
Thank you.
I would like you to give us a brief introduction about lasers and how they work and what are the usefulness of lasers in dentistry.
Thank you, Professor Rashid. Today I have thought that we are going to have the presentation like ever we used to do, having the slides and going on explaining the thing on the slide. But I was
जी.
thinking that if it is better that there are so many viewers all around and they can ask me the question regarding laser, and I can spend this time rather than giving a outview, because maximum people know in their FSE and then all their educational parameters in BDS that what
जी.
is laser and what are their uses. It's just a brief description I am going to give you without any slides, and then we are going to have the questions from the audience, and we will love to have the discussion, interactive discussion in this period, rather than going for the formalities of the slides and video shows and like that. Ladies
Right,
and
sir.
gentlemen, laser is a acronym. Yani, it is a light amplification by stimulated emission of radiation. It is an acronym. Now, the light, you well know, it is 190 kilometer per second, and that speed is unlimited speed, that no matter can attain this speed. When this speed is there, the every matter is converted into light. Now, at the speed
Right.
of the light, you are going to have the energy, you are going to have the power, and you are going to have this direction of this energy, because it is an electromagnetic wave. Light is an electromagnetic wave which travels in the space, and it travels in the medium. When it travels in the medium, the parameters of the traveling of the light is entirely different when it is moving in the space. When it travels in the medium, it used to be deflected by the medium in different direction and in different wavelengths. So when we are traveling in the space, there is no any particles, there is no other wavelengths which can disturb the light, so it travels in a very straight way. The expansion of the light is due to its wavelength. There are different wavelengths, right, starting from the 380 nanometers to 730 nanometer. This is the parameters of the laser visible light. Now, visible light is actually a white light. It contains seven different colors, and these colors starting from 380 nanometer is blue color, and when we are going to 730 nanometer, it is red color. In between the blue and the red color, this is the whole visible spectrum of the light. Ladies and gentlemen, visible spectrum is that spectrum which our retina can see. See, above to the 730 nanometer is the infrared. Infrared goes slightly above to far infrared, and then it is the big infrared going to very deep level. If we come to 380 nanometer and reduce it to low, it is called as the ultraviolet range. In ultraviolet range, it is going deep, and there are millions and millions wavelength available from above to 780 nanometer, and 380 nanometer in the middle spectrum we can see in our retina. Now, this is just, I'm giving you the brief of the light. Light travels in a direction which is not a one direction. It is sometime up, down, right, left, because due to different wavelengths. While in case of laser, we have one wavelength which is traveling in the straight line. It is coherent, it is united with each other, and there is power in this light. While you say in the general visible light, it has no direction, it is of white color, and it attain less power because it is spreaded. In case of laser, we have very bound energy, we have very precise direction, and it is united. So that's why it travels in a straight line. I am not going to give you the detail of the physics of the laser. It is very easy to understand that in your FSC, you understand whenever any molecule absorbs the energy, it is called absorption. And when there is absorption, its electrons used to jump into higher level, and that is called absorption. But you well know that any electron, when it is in power, when it is absorbing, it do not retain its electron at the higher level. It's used to come back to its original level. When it's used to come back, it emits the photon, and that is light. This photon is called spontaneous emission photons. But in case of laser, what we do, that when this photon is coming back to its original level, we hit by another photon which
Mhm.
give its direction and which duplicates it, and that is the actual theme of the laser. In 1917, Einstein actually developed the first concept of stimulated emission. This first concept provided a platform for the generation of laser. Later on, Theodore Memon introduced first concept of the maser, and then
Mhm.
uh, first Luby laser was invented, and then after that, the Chandri Kumar Nathan Patel, he invented the first carbon dioxide laser. Later on in 1960, there's a development of Ndag. Then after 64, there was a iridium jab, and then the every damn particle of the what you say uh, periodic chart, we are able to generate the laser of the lasing medium. Now, what you see in the laser, when you see a laser, just you push the button and there is a light going there. But inside the tube, what you see, there are two reflected mirrors. In the center, there is lasing medium, and then there is generation of the energy. When the energy is in that chamber, this laser medium strikes to these mirrors, and when it strikes hard, it becomes a stage which is called population inversion. This population inversion means that the maximum energy has been gathered in the laser tube, and then there is slight leakage on one side of the mirror. That leakage give its way that this whole laser is emitted from the laser tube, and that is called the laser formation. This is just a simple phenomena which I have described it to you for the
Right.
generation of the laser. Now, laser, when it is emitted, it has certain effects. You see, when you are on the sunlight, you feel heat. When you are on the sea beach, you are lying down on the sea beach, you are relaxing, and what happened to your skin? Your skin become brown, and people used to love that I am taking the sun bath and my skin is brown. That means that the light has the effect on the living tissue. You see, when the person they are working on the sunlight, their melanocytes, they are very active, and that results into formation of the darkish color of the skin. And when you are in the cold, when there is less radiation, but when you go above to the mountain, there is more ultraviolet rays, and when you are exposed to ultraviolet rays, does your skin become have the irritation, and sometimes you develop the blisters. That means the light has effect on your living body. So the scientists started working on it, that what is the effect of light on the living tissue. They taken a living tissue, say they have generated 380 nanometer wavelength, and they are put on the living cell. When they are put on the living cell, what they saw, that there is movement of the mitochondria. And you well know the mitochondria produce the ATP, that is energy. And they said that by giving this light on the living cell, basically we are generating the energy, and that energy resulted into movement of the mitochondria within the endoplasmic reticulum. And this concept resulted into generation of the laser equipment for the device of the what you say producing more biological effects which is positive to the human body, and to eradicate certain symptoms. Say I say that there is hypothyroidism, and I generate a wavelength. In that wavelength, the thyroid glands, when I give energy to the thyroid area, it become the energetic, and there is activation of the thyroid tissue. And due to the thyroid activation, the production of the thyroxine increases, and that results into our motive of increasing the thyroid activity. And that is what the laser is doing nowadays. We have developed the laser in such a way that we can activate any biological event by using different wavelength. And this wavelength different parameters has given us a long range of its utilization. I give you an example. Say eye. In the eye, there is, in the old age, and especially the person with the hypertension sometimes get the diabetic retinopathy. In the old age, there is diabetes, uncontrolled diabetes. And what is there, that on the macula or on the retina you start angiogenesis. And due to this angiogenesis on the retina, what happened, that the retina is covered by the blood vessels, and the patient become blind. The patient become blind. What you do, that you put the laser into eye, and you burn those vessels which are covering the macula, which is covering the visual spot. But remember one thing which is very important to understand, and that is why laser is not damaging anterior chamber, posterior chamber, lens, vitreous. It is passing all through these materials or tissues, but it is not damaging. It is only evaporating the vascular area. No, that is the laser, what you say, miracle. The miracle is that laser has a property. It is only absorbed to its particular color. Say red color is the laser red color. If we are using the red color laser, it is giving its effect on the red color only. You give a red color to the blood vessel, it will be burned. But all the other tissue, all other which are what you say having no color, it will not be absorbed in those non-coloring tissue. So it will affect only that region which is there on the blood. So that is the miracle which we have attained by the laser, that it affect only on this particular wavelength. Now we have the different wavelengths, and these wavelength has different parameters. And right starting from the smaller parameters, going up to the higher parameter, as we raise the wavelength, the energy is raised, its effective raised, its absorption is raised. So in the initial stages, all those lasers which are of less parameter, they are used for the photobioactivation. That means to get the biological effect by these laser. Then as we move above, we get the other application of the laser which are very much related to its heat generation. That is cutting, that is vaporization or debulking of the tissue. Like we have the Ndag laser, like we have the carbon dioxide laser, we have the iridium YAG laser. These are lasers, they are used for the cutting, evaporation, and cutting. These lasers are actually very important for not only for our oral cavity but for the whole body. We have developed many parameters to give this laser a promising effect for the body. Now, the
Right.
carbon dioxide laser is very much famous, and that is a 10.6 nanometer, and that is in the far infrared spectrum. It's used to cut the tissue very nicely, and you see the zero point 0.6 micron is the focusing spot of carbon dioxide, and there is no any scalpel so sharp. So we used to say that the sharpest knife in the world is the light knife, and that is a laser. Whatever the laser it may be, is cut so sharp that it is cutting like a model. Then iridium jag, then the anti-jag laser. We have the different devices to evaporate it, to cut it, to coagulate it. So these are so beautiful instrument that you see that zero point 0.5 mm of any vessel we can have the coagulation. And especially when we are going in the oral cavity, it is an astonishing result. Oral cavity, we
Right.
have teeth. Oral cavity, we have the soft tissue like tongue, palate, cheek, lips, and we have the floor of the mouth. Now, all these things, whether they are hard tissue, whether they are soft tissue, we can have all things in our mind, and we can have the better biological effect as well as the heat related effect of the laser. For the biological effect, we used to use the laser maximum, especially in the healing of the apathies, in the healing of long standing ulcers, in the healing of the different burn wounds and keratinized areas. We used to apply this. Then we are using to have the soft laser effect on trigeminal neuralgia. You apply that certain wavelength in certain joules on the nerve ending which is being having the trigger zone, and you uh, favor the myelinization of the nerve by its photobioactivation. And this myelinization by the photobioactivation results into recovery of the trigeminal neuralgia, which is sometimes very difficult to attain by other parameters. Then we have the healing process. You see that there are many studies that after the getting the dry socket, you clean it and you apply the soft laser, the healing promotes, the epithelialization it is improved. And that is the what you say a miracle of the soft laser, that it gives the prompt healing effects on the wounds. Next is the hard tissue. We have the water laser, we have Arabian laser that we use to cut the enamel dentine for the caries. Rather than going for the GV blacks classification, that extension for prevention, class 1, class 2, class 3, class 5, no need. Just go for the ablation of the tissue, hard tissue, which is the carious part, remove it, evaporate it, and you have the rough surface. You don't need even the etching of the area for the filling of the composite. So you just place all the filling material there, you just have the light cure on it, and it is retained like anything without losing the good enamel tissue or dentine tissue. We are going to have the very good filling. Then is the perio. You see the gum recession. It has been proved that after going a good gingivoplasty, you apply the soft laser there. There is a good retention of fibroblastic activity, and there is good attachment of the fibroblast to the neck of the tooth, especially at the cemento-enamel junction. And you enjoy a very strong cemento-enamel junction with the free, what you say, gingiva. Ladies and gentlemen, now sometimes sterility of the gingival pocket is very important. No, that sterility, just you go for the just moving the probe on the free gingiva, and if it is a one wall defect, two wall defect, three wall defect, you provide the aseptic condition there. And that is the no use of any chemical, no drastic chemical like chlorohexidine. You are using sodium hypochlorite, you are doing the hydrogen peroxide, and so many other chemicals just to sterile the area. There's no need of such thing. Just go for the probe of diode laser, say at 613 in for 40 nanometer, and give the probe to the in the gingival pockets. You sterile the area by just without any pain. Then is the very important thing, the removal of a different tattooing on the surface. It only you see the exposed gum sometimes has a more melanin deposition in the attached gingiva, and that is the ladies used to come to you that, sir, what to do with this black staining. And the periodontologist sometimes have to cut the even attached gingiva to give the beauty to the lady. But what the miracle laser has done, you ablaze the surface of the melanin deposition of the anterior gingiva, which is exposed to the open atmosphere, and reepithelialization results into absolutely new gingiva. Now, these are the miracles which a laser has done in dentistry. And really, we have changed the era, and the time is coming, we will people will forget the use of hand pieces and use of these scalpels in the oral cavity, and it will be replaced by the dentistry in dentistry by all type of laser. I am very proud that especially to DentoScope, that they have given me the chance. They have asked me to go ahead for the slide projection. I said that this is a formality type of presentation. I want that there should be a question, and I should answer these questions live and interactively. You are open. Now it is over to Dentoscope. Please, if you have a question from the audience, or from you, I'm here to answer you.
Yes, sir. One question is that what is the cost of lasers which are used in dentistry?
Acha, ladies and gentlemen, you see, one 1996, I have done certification in the laser. At that time, people never think of that. Atomic Energy Commission Islamabad has at that time one course of the 1 year, and that is the authenticated course. It is not by the ordinary pupil; it is by the PhD pupil, and they have started this orientation program in 1996. 1 year course when I have done at there, and I was in the Penstack laboratory, and this Penstack contains one optic labs. And this optic lab is so well equipped in Pakistan that we are ourselves we are making the different lasers. And especially, I am proud of my department in Atomic Energy Commission, that we have developed our own carbon dioxide laser, and even in our aeroplanes we are capable of producing the aiming what you say laser. When I started carbon dioxide laser in master degree, when I have done MDS, and my topic was comparative study of wound healing after partial glassectomy by carbon dioxide laser versus scalpel. The people have not been born, which used to claim today that we are the laser specialists. They were not even born at that time. When we have in Atomic Energy Commission Islamabad, we generated our own carbon dioxide, and we have started the experiment on spraying dolly rats and done the partial glassectomy of these, and we proved that the 3-watt laser of the carbon dioxide is more effective than that of the 6-watt carbon dioxide. People were astonished, and they said, how doc you can say that the 6-watt is less effective and 3-watt is more effective? We said that the penetration of the 3-watt was so effective that it cut the tongue in error of second, but the 6-watt is so drastic that it burned the tissue beneath it. So at that time, we have started in Pakistan the carbon dioxide laser by the Atomic Energy Commission. And now, at that time, Satluck France was the pioneer of a carbon dioxide laser, and it was 2 crore rupees at that time. Now we in Pakistan, we have availability of a second hand laser as well, and first hand laser is also available. The diode laser is very not very expensive, and even we are thankful to the China that it is producing very good lasers, diode laser, and even if up to 6 lakh rupees Pakistani, we can afford the laser now, a diode laser for our general dental surgery use. So it is not so expensive. Don't worry about it. There are so many other equipment, they are more expensive than the laser. Say we used the equipment in implants, they are sometimes more expensive than the laser, but the benefit of the laser is no doubt about it, it is more promising now. Thank you.
Right.
Dr. Amna is saying the wit laser is the most commonly used in dentistry. I actually, the words is commonly used. That means the
Right.
general practice, that means the ordinary dental surgeon, and which have not gone for the even for the bigger degrees of the laser. I will recommend diode laser, and that is starting from the 400 to 830 40 nanometer. It can has a photo bioactivation as well as cutting procedure as well. I think that diode laser is very promising for the dental surgeon for their private practice.
Right, sir. And another question: can laser remove old restorations?
Restoration removal by the simple laser is not possible, because simple restoration removal required hard laser, water laser, or you can say the Arabian laser. They are capable of removing the old restoration, but not the routine laser. They have not such penetration that they can remove the hard tissue depth of the restoration. That is sometimes not possible.
Okay, that is not possible. Then I guess there is some comment for you, sir. Maybe one of your students.
Yes. Thank you very much, uh, Starshine B. Thank you very much.
Sir, there is a question.
Can use the laser reduce the chances of further caries? I doubt that it has no relation with the prevention of caries, because laser can activate the fluorescence. Yes, if you have any material which can be activated by the laser, say laser activated fluoride application, and you apply that and you activate it by the laser light, then obviously it is going to convert the hydroxyapatite into fluorohydroxyapatite, which is very resistant to caries. And that is the only way. Just by applying the nude laser without any chemical activation, I don't think that you can prevent the caries. You have to apply the fluoride application, which can activate the hydroxyapatite formation.
Right, sir. So, generally speaking, how which are the dental treatments that could be treated with good prognosis with lasers nowadays?
I can say that the things like prosthetic things, where you have to make the denture, or where crown formation, these things are certainly, they cannot be done by the laser. Otherwise, there is no any treatment in the oral cavity which
Right,
cannot be done by the laser. You can
right,
do endo, you can do endo sterilization, you can do the filling, you can go for the perio application, you can go for the removal of the oral lesions, you can control the pain, photobioactivation by the neuralgias and other pains. There are every aspect laser can be used. It is the
right,
only the thing where there is manufacturing. I think that it is the only thing which the laser cannot do, because you have to do it manually in the laboratory. Otherwise, all the things which are, especially by the practical, it can be done. Every procedure can be done by the laser.
right, sir.
I have to
Right,
anesthetize the area during laser dentistry. The anesthesia of the surface of the mucosa, it is you see, we have the mucosa, we have the epithelium, we have basement membrane, and then we have the connective tissue. And in the connective tissue there are nerve ending. On the epithelial surface we have the stratum corneum, stratum granulosum, stratum spinosum, and stratum basale. All these four lines contain no any nerve ending. Then is
right,
the lamina lucida and lamina densa. Both are the basilar membrane. And then is the connective tissue. Up to the epithelialization, or up to the lamina lucida, lamina densa, the laser application is without any type of anesthesia area. It used to soothe the peripheral nerve ending, and there is a sometimes no need of any anesthesia. I have
right,
done many freenectomies and surface ablation of the certain scars without any what you say, local anesthesia. The local anesthesia is only required when you are going to have the deep cut, and that is sometime required. Otherwise, surface application of the laser don't need any type of anesthesia.
right, sir. Um Sir, this another question.
Yeah, the sir orthodontics are
Yes.
using the laser
Yeah.
nowadays. And can you tell the how the orthodontics type of laser is being used? Very good question. Orthodontics has the wide range of application of the orthodont. Number one is the surgical application, and number two is photobioactivation. Now, surgical application is that there is canine impaction, and you want to denude the canine impaction, and you just go for the surface of the bulge of the canine, and you remove the surface without any pain, without any local anesthesia, and your canine is exposed. Secondly, in orthodontics, sometimes we used to perform the orthodontics, especially which is called as camouflage. And in camouflage, what used to happen, we have the gummy smile. And this gummy smile is that the gums are more towards the crown, and there is certain portion of the crown, it is hidden within the gums. So whenever the patient smile, it has more exposure of the gums than the teeth. So what we do, that we expose the, we cut the gums, and we elevate the visibility of the crown by the what you say, crown lengthening, which is, you can say it, crown lengthening. and that is absolutely without local anesthesia. Just patient is sitting, and even you give the mirror to the patient, and patient is looking at that, and you are giving a curve to the crown, and the patient is smiling, and her visibility of the crown is right there, and gums are gone. This is second application in orthodontic. Third, some people has the light curing of the orthodontic brackets by laser, and this is there are different materials which are used for the curing of the bonding material by the lasers. This is the third application. Fourth is the photobioactivation of the movement. It has been approved that you apply the orthodontics brackets or clear aligners. You place it there, and then you give a episode of a soft laser daily for a few days. The activity which you are going to get the movement of the orthodontic movement in 15 days, you are going to get it in half of the time, because it give energy to the area, and this energy results into absorption of the energy in osteoclastic activity, and that osteoclasts move more aggressively and give more space to the orthodontic movement by this laser active photobioactivation. Secondly, the fibroblastic activity is more generated by means of the laser. On the opposite side, where there is traction, there is fibroblastic activity, and fibroblast favors the movement of the orthodontic movement to the particular direction where the person is moving the tooth. So these are the miracles of the latest photobioactivation in the ortho movement.
Right, sir. It's good that people are coming and they are showing interest and asking different types of questions. Very interesting, really. So there is another question, sir. How long does it take the gums to heal after the laser?
Uh, the question is broad more as compared to precise one. Gums mean gingivectomy. Gums mean surface ablation. Gums mean crown lengthening. There are different procedures, and according to procedure, the healing period is decided. Now, when you have the only surface ablation, it heals in 4 days, while in routine it's used to heal in 7 days. While you cut with the laser, it's used to heal in 5 days. Routinely is used to take 7 to 8 days. When you have the gum curate arch and gum sterility or perio pocket elimination, or treating the any what you say bony defect area, is used to take 10 to 12 days. So it is according to the use of the laser in particular defect of the gums what you are going to use.
Right, sir. So the next question. Yes, sir. Okay. It says that, dear sir, what about the application of laser surgery for excision of pre-malignant lesions? Like, there are any advantages as compared to the conventional scalpel blade surgery? So basically, a comparison between.
I say that pre-malignant lesion is a very vast term. Say leukoplakia, erythroplakia. There is also you can say lichen planus. You can say submucous fibrosis. These pre-malignant lesion, there are many more. Sometime on the tongue, melanoma is benign and it convert into melanosarcoma. Sometimes it become aggressive. So these lesion which are pre-malignant, they shows their activity with reference to age. The young age give a very precise response when you go for the laser, but in the old age the response is not so promising. For excision of pre-malignant lesion, I will say that one must confirm it with the biopsy. That if the pre-malignant lesion has
Right.
not involved a basilar membrane, it is above to the basilar membrane, say carcinoma in situ, you are just on the surface, then the laser is excellent one. Then it ablaze the tissue in such a nice way that there is no remnant left, and you are free of the pre-malignant lesion. But the pre-malignant lesion must has the precise size. It should not be unlimited. Say I say lichen planus, it has involved the palate, it has involved the soft tissue of the cheek bilaterally, floor of the mouth, lateral border of the tongue. So you cannot ablaze whole of the oral cavity by the laser and you make it like this. So it is how. However, if you want to ablaze this type of lesion, you have to go step by step. So for the leukoplakia, yes, if leukoplakia has no any aggressive type of changes in the biopsy, you can say that it has not more atypia or dysplasia, then you can go for the laser use. That is no doubt about it. It is very promising in the pre-malignant area.
Right, sir. Sir, the next question is that, sir, can we use the same laser system in our clinics for skin treatments as well, especially aesthetic treatments?
Actually, this is expertise own question. Uh, are you expert to use the laser on the skin? That is the question. If you are capable of using the laser on the skin, you must know the what are the different type of lasers used on the skin for resurfacing, for removal of the contractures, for the removal of the ugly scars, for the removal of the tattooing, and all. They are the different laser application. There is no one single layer laser that you are going to apply this laser for the all type of lesion. So you
Is there
must know.
any difference in the wavelengths of the for any treatment, or
Yes,
it's the
there
same?
is difference of the wavelength as well as the instrumentation. You see, the certain instrument they are controlled by the hand and focusing. Certain instrument they are controlled by the focal length, by precise focal length measured by its own gadgets. There is
Right,
a stopper, and it is only the focusing gadget which you can use by those things. And these are the very special gadgets, and they are being the person is being trained, and then they are given formality to use it.
right, sir. Right, sir. Okay, so we have another question, sir. Uh, well, he says that, sir, can biopsy be done with laser to make less traumatic?
Very important question is that what lesion you are going to have the cutting. No doubt, it has been proved that the laser cutting do not alter the structure of the tooth morphology. Sorry, tissue morphology. It is there. You can use it by biopsy at the low level joules. You are not allowed to use it in high jeweler level. So high energy can distort the histopathology of the biopsy tissue, but the low joules and less energy, definitely it gives you a promising result.
Right, sir. Okay. Well, I think with the as the time goes on, more and more people are joining us and asking questions. Does laser surgery cause any scar formation?
It is a one of the advantage of the laser that it prevents the scar formation. The philosophy behind it is that it do not diffuse its energy more to the deeper tissue, and especially it do not expose more drastic energy to have the more drastic f3 fibroblast. The f3 fibroblast basically are more active and they form the more collagen. So this is the beauty of the laser, that it used to activate f1 and f2, but it do not activate the f3 fibroblasts, which are scar forming and which are actually the making the ugly look of the wound. So it is another advantage of the laser, that we have the less scar formation after laser surgery.
Okay, right, sir. Okay, sir. Sir, apart from laser, I have a question that is brush biopsy being used nowadays, and is it significant?
There are certain reasons from where you need the brush biopsy. People used to say that because it takes the surface only, and this have the least traumatic effect on the person, and less there's no pain. But the limitation of the brush biopsy, yet you well know that it only used to take the surface deepithelialized tissues, which can be which maybe for your what you say need, or it may not be of your need. That's why it is not being used these are days. Certain people used to take brush biopsy in those especially lesion which has the hyperkeratosis, and they used to take this brush biopsy, but it is not there's no match of the Incision biopsy with comparison to brush biopsy.
So, इसमें थोड़ा सा can you brief the difference between brush biopsy and the incision biopsy for the audience?
ब्रश में आपसे एक माइक्रो सा ब्रश होता है, उसके अगर ब्रेसेस लगे होते हैं तो हम इसको घुमा के लीजन वी यूज टू अप्लाई इट ऑन द लीजन, एंड वी रोटेट द ब्रश, and that tissue surface which is having contaminated or deepithelized tissue, they are attached to this brush. When then you dip it into formalin, and at the surface which we get, we place it on the slide, and we see that whether there's any atypia and malformation, and anything like that. We used to have that, especially in the viral infection. We used to take this breast biopsy, especially in the what you say Epstein-Barr virus lesions. We used to take these type of.
Right, sir. सर आप थके तो नहीं हैं? और एक दो
Oh
क्वेश्चंस
no,
हैं
I'm always there. There's no problem for me. If any question you want to ask.
sir. The question is the what is the ideal wavelength for the dental treatment
Dental treatment
regarding?
requires two type of tissue. The one is the hard tissue, one is the soft tissue. The hard tissue needs the more heavy, what you say, wavelength, that maybe in the infrared range, and that should used to expand our 10.6 nanometer, while in the soft laser we don't need to have the more aggressive one, that is approximately up to 850 nanometer. We can have the cut and we can have the ablation of the that thing. But for photobioactivation, up to 400 nanometer, these are the best wavelength for the photobioactivation by the diode.
Mhm. Okay, sir, I want to install laser system in my running clinic. How much budget should I keep in my mind?
How much is the patient you are going to get? First, you have to see. that what type of practice you have. And it is not just a showpiece that you are keeping the laser. You have to see that what the capability you have, what type of laser treatment you are going to do, what are the patient threshold coming to you and asking you for the laser treatment. It is not like this that you are just keeping a laser with you, and the patient is now, you are just waiting for the thing, and then you what you start, that you start everywhere application of the laser where it is required or not, just to compensate your economy what you have invested. So first the thing is that I think that you take the diode laser, that is more promising for the general practice, and then you start applying right from the soft tissue, frenectomy, gingival application, resurfacing, and then you go on expanding yourself.
Right, sir. So we are left with last two questions. Um, okay. Can we use the lasers for trigeminal neuralgia? What will be the prognosis?
In trigeminal neuralgia, we can use the laser in two ways. One is the neurectomy. You open it and you go for the neurectomy by the carbon dioxide laser or by the Ndag laser or any hard laser, which you are going to ablaze the nerve tissue by means of laser. It has been shown that when we used to apply the neurectomy by the laser, it used to have less neuroma formation post-operatively. There is good coagulation of the nerve trunk more posterior to the foramina in the canal, whether it is a ID canal or whether it is infraorbital canal. You send the probe to right in the infraorbital canal, and the ablation of the nerve is right posterior to that, and then there is less bleeding as well, and there is a less post-operative neuroma formation, as well as we have seen that there is a less regeneration of the nerve ending. Secondly, is the photobioactivation. It has been shown that the tragal points which used to have the more tragal, we used to apply the certain joules, say 4 to 5 joules of the energy of the soft laser to these areas intermittently for 2 to 3 days in these areas. It results into more healing pattern of the myelin sheath, and that results into reduction of the episodes of trigeminal neuralgia in that patient. No doubt it has effect on the trigeminal neuralgia management, both in the soft laser as well as the hard laser.
Right, sir. Okay. Is laser root canal better than the traditional one?
Root canal in endodontics, root canal treatment is has changed the parameter, and laser has absolutely changed the parameter. No, the time is coming that when there will be no endodontics, and it will be whole replaced by the laser. The laser endoprobe, when we insert into the endodontic canal, is used to melt the dentine. It is giving two effect at a time. One, it is sterilizing the canal at once. Number two, it is melting the dentine of the periphery, and hold the dentine from periphery. It is melted and it is coming into dentinal canal. And your dentinal canal, dentine canal is pulp canal in the root is filled by its own dentine. So no obturation material, no repeated dressing, no anything for the endodontics. You are doing the endomotor, you are doing rotary, you are doing this. There will be no concept in the future. We are going to relieve all these concepts, and it is being replaced by the laser endodontics, and that is by the melting of the dentine into the dentinal canal, sterilization as well as the obturation in one endodontic probe.
Right, sir. So, okay. Sir, Do we have dealers in Pakistan dealing in providing the laser systems for general dentistry?
I don't know as such there is a big dealer of dental laser in Pakistan. There are skin laser dealers are there, but particularly there are different dental depots, especially Western Scientific Traders and Hamayu Dental Supply. Uh, these used to provide the dental laser on request. Generally, they are not dealing with it, but if you want and then there is a gentleman in Academy of Laser Dentistry, Academy of Laser Dentistry, and that is very respected Professor Dr. Johoria. Both Dr. Vakas and Dr. Joria, they are working a lot in dentistry in Pakistan. They are conducting very good courses as well, and they are potentiating a laser. My salute to both of them, Professor, especially Joria and Dr. Vakas. There are other gentlemen. I forget the name. Forgive me. In Lahore, he is also working in laser. These few people, they are mashallah working a lot in the laser to develop laser in Pakistan.
Right, sir. Okay, sir. This is another question, sir. Can you please tell the difference between Ndag and diode? Which one is better?
Both has their own application, their own indication, and own uses. Ndag is a very potent hard laser and very expensive as well, and it is used for the general dental surgery, especially tumor surgery, incision, evaporation, and other things. While the diode laser is a simple laser, it can go for the simple um, dental procedure, cutting and ablation and gingival application and all these things. And I think the diode for the routine dental surgery is better as compared to anti-jag laser.
Okay, sir. Uh, the quick questions are keep on coming. Okay, sir. In terms of preventive dentistry, does it really help to arrest or even prevent the caries? मेरे ख्याल में ये
That
पहले
I
भी
have
discuss की.
given question already. I have answered that if there is fluoride application on the teeth with certain plates and you are going to activate it by the laser, yes, then it has the preventive direct.
Right, sir. Sir, artificial intelligence is taking so much hype in dentistry nowadays. Sir, few words from you regarding it.
Artificial intelligence is really remarkable in not only in dentistry, it is in especially in neurosurgery and cardiac surgery as well. You see the operating on a system without what you say a manipulation of your brain work or your spot diagnosis. If you have the monitored and you have the calculated parameter for certain treatment and you have given it to a robotic or other intelligence spectrum, you can have the better movement in the diagnosis and treatment. No doubt it is a very big chapter, but in dentistry yet I don't think that there is much work has been done, but it is an open field for future to come.
Right, sir. So, in the end, there are a few comments. Uh, yes, sir. Laser should be made common, and people should be given awareness about lasers. Cost is very important factor in Pakistan, especially nowadays.
Yeah, obviously.
There is another comment. Okay. Star Shine B. Thank you so much, sir, Arshad and Sir Rashid, for coming up with such a relevant and helpful discussion, as well as giving us the platform to ask from the best.
Thank you. Thank you, Betty. Thank you very much. for your comment. And I think that we are coming to the last minute of our presentation, and I'm
Yes,
really
sir.
thankful to you, especially I will regard the Dentoscope giving me the opportunity. And this session we have made it on a very another way, rather than going for the slides and showing the videos and other things. We have made it more interactive, and very much thankful to you for arranging this
Yes, sir.
broadcast.
This is
So,
another comment for you, sir.
thank you very much.
Thank you so much, sir, for taking out your time for giving us the brief introduction and clearing out all the queries of the viewers regarding lasers in dentistry. Inshallah, we'll try to arrange another session, a more elaborative one for lasers in dentistry from you,
I think
inshallah,
that
in future.
this laser in dentistry is a approximately uh, um, 2 or 3 hours job, and I will request Dentoscope to please arrange this session, a full day session on the laser in dentistry, and I think that I will elaborate there more precisely.
Ji sir, inshallah we will arrange a complete full day session on lasers in dentistry by you at Dentoscope campus, inshallah, both at Lahore and Rawalpindi, inshallah, in future.
Thank you very much. Thank you. Thank you, everyone.
Thank you so much,
Everyone.
sir. Thank you so much,
Thank,
everyone, for your
thank
today's time. Thank you so much, sir.
you. Assalamu alaikum.
Jazakallah. Thank you. Assalamu alaikum.